My name's Lisa West. I'm professional lead nurse for community in West Sussex, working for Sussex Partnership Foundation Trust. I qualified as a registered mental health nurse in 1995, so I'm really proud to say that I've been a mental health nurse now for 25 years. The majority of my career has been in community settings, working either in a group treatment setting or our community mental health teams. I'm really passionate about community mental health nursing and the role that nurses play in those community teams. And I'm really keen to support people to have their treatment in their own homes and wherever possible, avoiding hospital admission. My clinical interest is people with complex emotional difficulties and enabling clinicians to develop really comprehensive treatment plans. And I am keen that those treatment plans involve everybody involved in that person's care, including friends, family and carers. I often work closely with our quality improvement team, and I'm really passionate about enabling our community teams to get involved in improvement work, and I'd like to encourage and support and enable nurses to get involved in this work. I applied for the Florence Nightingale scholarship because I'm really keen to go on a journey of personal development and to understand a little bit more about my own leadership style. As you can see, I've done some formal academic training around MSc, BSc, postgraduate leadership, but for me the Florence Nightingale scholarship is about personal development. So, what did the Florence Nightingale experience mean to me? There have been some fabulous learning opportunities and a really great opportunity to look outside of my organisation and come together with a really inspirational group of nurses from such a range of clinical areas. We've had some really great formal training on leadership from the King's Fund, and I've used the opportunity to visit community teams in Oxford and Liverpool and learn about how they work in different areas. I've had a fabulous day at Westminster Abbey where I sat and reflected on my last 25 years, and I've had some really good shadowing opportunities both within my organisation and outside of the organisation. I've been really lucky to be allocated a mentor, Michelle, who has been a really great inspiration. It's been a fabulous opportunity to think about my leadership style, my confidence, my doubting voice in my head, my imposter syndrome. And it was Michelle that really strongly encouraged me to face some of my fears and to go on a personal transformation course at Cranfield University. That was one of the hardest things I've ever done. A course open to senior managers from corporate institutions, so I was the only nurse there, so immediately had to face all my fears and my feelings of being an imposter. But I learnt so much about my own personal journey, the impact of our life stories on who we are today. And from that I took away that I should be really proud of being a nurse, really look after myself and learn to set some boundaries as well in my workplace. In addition to that experience, I've had RADA, which again was about understanding my own impact and presence as a leader, which again was equally scary but equally rewarding. My quality improvement project was co-facilitated with Jacqueline, our Trust Carers lead. We know that family, friends and carers of people accessing support from our community mental health teams are not routinely identified by clinicians. Clinicians were not working collaboratively with all people involved in the person's care. So our aim was to improve that engagement with family, friends and carers, and to increase the number of family, friends and carers identified at assessment and recorded on our care note system. At the beginning of the project, this was 5% of people recorded, and we aimed to get to 25% in 9 months. We know that working collaboratively with people, all the people involved in a person's care, will increase the quality of the care provided and reduces the risk and enhances relationships with the clinical team, the family and friend, carer and service user. Our project group consisted of our trust carer lead, professional lead nurse, 2 team leaders, occupational therapist, 2 community nurses, 2 social workers, 3 carer representatives, 1 paid carer, 1 expert by experience and an admin lead. The project had an identified exec sponsor, our chief nurse, and a QI coach. We used quality improvement methodology and principles throughout, which included carer and clinician engagement groups and understanding barriers and identifying change ideas. We used a driver diagram to provide a structure for the work, and data was collected to measure change. Data showed significant improvement in carers identified from 2% to 37% over the time of the project, and these details are available on the Life QI system. The Quality Improvement Project had an impact both on the team and the care and treatment delivered. The team reported increased confidence in engaging with quality improvement work and a real sense of pride of what they've achieved. They had a greater understanding of why they should be working with friends, family and carers, and a determination to change the culture of the team. The data showed a significant increase in carers identified at assessment, suggesting clinicians are discussing friends, family and carers when patients initially come into the service. Carers in the project group recognised a gap around support for carers when their loved ones are in crisis, and they developed a Z card that can be given to carers at times so that they have access to all the immediate numbers. The project will be shared at trust level, soon to be presented to the quality board, and there are plans to engage teams in similar projects in other areas and share learning. Jacqueline and myself have taken time throughout the project to reflect on our leadership style, and it became apparent very early on that our role was around enabling and a collaborative approach. It's been key that we take time to engage with clinicians and carers, creating a space and opportunity for conversation. And this has enabled the ATS to engage in the change. Historically, there's been team training, and engagement in that has been quite low, and we learn that actually working alongside the team, listening and developing with them has been much, much more effective. In my introduction, I said I applied for Florence Nightingale Scholarship as I wanted the opportunity to go on a personal journey of development and an opportunity to reflect on my leadership style. Over the last year, I've gone from really doubting myself, my strong sense of imposter, to seeing my opportunities and potential as a senior nurse leader. Thank you to all of you who have contributed to my incredible journey. I've learned so much, made friends for life, and have laughed and cried. I go into the future with a greater confidence and determination to continue with improvement work, which will ensure we provide the best care possible for people who access our community mental health teams in the future.